So we are all shocked to hear that 18-year-old Bronny James suffered cardiac arrest at practice recently at USC. They were able to revive him and get him to the hospital. He's out of ICU, but they're doing more tests to see what exactly happened. And I thought before we get into the theories of what may or may not have happened, let's hear something from a doctor who knows a lot of bit about the heart.
Welcome back, everybody. I'm Dr. Brian Suter, and my goal in this channel is to help teach you more about the medical side of the world of sports. This is obviously a very serious story. Essentially, when someone goes into cardiac arrest, their heart has stopped beating, and they're essentially dead until somebody is able to revive them or resuscitate them. And so this is about as serious a situation as we can see in the world of sports. This was the statement that was put out this morning, saying yesterday while practicing, which is important here, Bronny James suffered a cardiac arrest. Medical staff was able to treat Bronny, take him to the hospital. He's now stable and no longer in the ICU. Number one important thing here when we talk about this is that he was practicing. So presumably there was some type of exertional component or something that happened around his athletics. It wasn't like he was just in bed at night and had cardiac arrest while he wasn't exerting himself. And so this sort of story of somebody having cardiac arrest or their heart stopping while practicing or doing their sport suggests, of course, more of these exertional sports types of causes of cardiac arrest. Cardiac arrest occurs whenever, for a variety of reasons, the heart stops beating. Cardiac meaning heart, and then arrest, stopping. This is different from a heart attack. A heart attack implies that there has been some blockage in the vessels supplying blood to the heart, like atherosclerosis or plaque buildup, that then cause, from a structural reason, the heart to then stop beating, as opposed to just cardiac arrest is a little bit more of a generic term, implying that something happened to cause the heart to stop beating.
So to be a little less long-winded in the next clip, the way to solve cardiac arrest is CPR or either defibrillate, which is to shock the heart and get it back beating again, and then get them to the hospital for further evaluation.
Now, once somebody's stable and they've been resuscitated from their cardiac arrest episode, the next and most crucial step is trying to learn about what exactly happens that we can prevent it from happening again in the future. When we look at the causes of cardiac arrest, specifically in athletes, there are a couple of general categories that we divide things into. The first is things that are congenital or genetic, meaning you were born with them, you had them from birth, you didn't develop them later in life. The second category are things that are acquired, meaning infections like myocarditis, things like Kawasaki disease when you're really little, or things like we saw with Damar Hamlin with commotio cordis, where something happens to an otherwise normal heart. These acquired heart diseases can then be further divided into a structurally abnormal heart or a structurally normal heart. A structurally normal heart means there was nothing wrong with the vessels. There was nothing in terms of coronary artery disease or plaque buildup. The heart, electrical activity and structural function was completely normal, but then something happened. This is the category where we would put commotio cordis, what happened with Damar Hamlin, where something strikes the front of the chest. This impact happens at just the right time point in the cardiac cycle or the EKG, which causes your heart to go into an oftentimes fatal arrhythmia. Substances and environmental factors can also induce some arrhythmias that lead into cardiac arrest. So these can again fit into that acquired but structurally normal heart. The acquired but structurally abnormal heart is where we see things like atherosclerosis, things that would lead to your classically understood heart attack. This is also where we'd see acquired infections, things like myocarditis, that can all lead to cardiac arrest. The bigger category, though, specifically within athletes, is the congenital. These are what we often see whenever we're talking about athletes who sustain sudden cardiac arrest. These, again, can be divided into the structurally normal heart or the structurally abnormal heart.
I have to take everything into account, but I don't know if Bronny's condition may have been congenital. Seeing that, I mean, you come up, you got some of the best doctors in the world ever since you're born. I don't know if they would not have noticed a congenital, meaning at birth, a problem since birth, all this time. You know what I'm saying? But we have to take it into account because Sharif O'Neal had a problem that he discovered in 2018, and he had to have heart surgery for it too. I'm gonna let him explain that one though.
The next most common causes of structural congenital heart disease that leads to cardiac arrest is anomalous coronary arteries. Within our heart, of course, the heart muscle itself has to get blood supplied from the heart, which seems kind of counterintuitive. But the coronary arteries are the arteries that come off of the aorta and then travel down to supply blood flow to the rest of the heart muscle. There's a typical pattern where these coronary arteries will travel, but in an anomalous coronary artery disease, The arteries grow in an abnormal fashion, and they can grow in an abnormal fashion to where they're prone to getting pinched or squeezed off between other areas of the heart. This is infamously what Sharif O'Neal had, where he had these anomalous coronary arteries, where they had to go in and do surgery to basically reroute and move where that coronary artery was to restore normal blood flow to the heart. Now the next stage comes, what exactly happened? Because it's not safe to let an athlete go back out and participate in sports after a cardiac arrest, especially if you don't know yet what happened. To evaluate what happened, they're going to look for, number one, was this something congenital or was this something acquired? They'll consider things like myocarditis. They'll then look at all of the congenital conditions. They'll look at the structural congenital conditions by doing things like echocardiograms, cardiac MRIs, maybe even a CT scan, and they'll look at the electrical causes of cardiac arrest by doing things like EKGs to monitor the electrical activity of the heart, stress tests where they put them on a treadmill, they exert them, and they watch and see if any arrhythmias are introduced in the heart function, and that will be how they determine what exactly caused the cardiac arrest. In a way, you almost hope that you discover a cause, because oftentimes if there's a cause, there is a way to at least manage it. Now, there are some causes of cardiac arrest that you find the exact cause, and it still isn't necessarily safe to return to sports because the risk is so high of having another cardiac arrest and potentially dying.
And so, as the doc intelligently put it, they now have to discover the cause so they can figure out if he can play again, if he's able to get back on the court, or if he just has to put it on the back burner. But I have to ask, are we trying to figure out all of the causes that there could be? And I say that because there's also a recent medical procedure that a lot of people have taken ever since we've been locked in the house. And people tend to dance around this as far as saying that it could be a possibility of that being a cause. I'm not jumping to a conclusion to say that it is, but I think it should be considered because we have seen a few cases where you wonder, why are so many young, healthy people having these abnormal medical anomalies, right? And you're like, was it something congenital? Did they have this since birth? Does it run in their family? Or is it something recent? And we all have to be careful how we talk about this, obviously, because people don't want that to be discussed. But just like we went through the medical history and all of the possible things that it could be, he elaborated heavily on a few more heart conditions that it could be, where your heart gets enlarged and different things like that. And I was interested to hear all of that, like its possibilities of all this being there. But I don't want us to ignore that last possibility. And we can creep around it all we want. But I'm just saying, if we're really trying to get to the root of people being healthy and figuring out what's wrong with people, that has to be considered as well. Like, y'all can't keep dancing around that, the elephant in the room. You understand what I'm saying? But it very well could not be attached to that as well. Like Sharif O'Neal, that was something that he had since birth. It was congenital, and it wasn't found until 2018 when he was active and playing. So this could be something that LeBron and Bronny haven't discovered too in the family, and then they're going to have to look through the rest of the family, the rest of the kids, to see if Bryce and the other kids may have those type of problems too, if it's congenital. But I just want us to be real about it, man. Like, because this is life-threatening. People are falling dead, and you don't know why. You don't know why. But it's always cases like this where people was jumping the gun on DeMar Hamlin, and then it turned out it was just from the impact of the situation, this, that, and other. But we have situations like Jamie Foxx where you don't know why. People were speculating as to what it could have been, but there were no definitive answers. And Jamie's family kept it close to the chest, and now he's back healthy and he's talking and joking again, and that's great. But they still haven't gave us any insight on what it could have been that caused his near-death life scare. You know what I'm saying? And so this elephant in the room has to also be a possibility that we considered. Like, it doesn't react to everybody's body the same way, So with that being said, people should be able to question things as a cause, especially given the tremendous pressure that Bronny is probably going to feel to get back on the court. I mean, this is what he's been playing for since his life, trying to measure up to his father, trying to want to play with his father. Hopefully he wants to play with his father, but his father wants him to play with him. It's a lot of pressure around that situation that'll make you as an athlete be like, it's like an injury. Like, yeah, my ankle hurt, but I'm ready to go, coach. And you don't want him to feel that pressure and attempt to get back in the game and not be healthy enough to do it and risk his life at it. And we all wanted to see Bronny and Brian play, but not at the cost of his life, though. But we're praying for you, Bronny, praying for the whole family, man. And we just hope y'all are healthy and healed. And that's whether you play basketball or not. I know you want to, but we love you just the same if you can. And that's about all I can say, man. It's your boy P. Camp. Let me know what you think, what you don't think. Get at your boy.